Good morning. In this video, we are going to try to cover all the points that we have covered in the first video, and we are going to start by this question: why do microorganisms infect us? So the answer is simple. Microorganisms are not evil. Microorganisms infect us just because they need home, they need shelter, and they need food. And in return, they give benefits to the human body, for example, by producing vitamins B and K. And we said that this applies mainly to the gut flora. If the organism takes food and shelter and in return gives benefits like producing vitamins B and K, then it is a friendly flora. But if in return the organism gives toxic metabolic wastes, then in such a case, the organism wouldn't be a friendly flora, but the organism would be pathogenic, because in friendly flora, what do metabolic wastes produce? They produce useful substances to the human body, but in case of a pathogen, the pathogens also have metabolic wastes, but these metabolic wastes are toxic to the body, and if they are toxic to the body, then they cause diseases. This slide is also important because it talks about the timing when you are first inhabited by microorganisms, whether they are friendly flora or pathogenic microorganisms. So at the beginning, you are sterile inside the uterus. The fetus is in the uterus of the mom. So you know that pregnancy, the duration of pregnancy is 9 months. During the first 3 months, you are called an embryo, but afterward, during the last 6 months, you are called a fetus. And you are covered by membranes and the space is sterile. But what happens at the time of birth? There is rupture of the embryonic and fetal membranes that surround the fetus. And there is a water gush, the water that covers the fetus will be released from the vagina. And you are delivered outside the body. As you are delivered outside the body, you are first passing through the vagina of the mom, and then you will be exposed to the surrounding air. You will be exposed to the surrounding objects, and you will be handled by the medical staff and by your parents, and then you will start suckling and breastfeeding in case you are breastfed. All these steps give you friendly flora. So during passage in the vaginal canal of the mom, you are acquiring what? You're acquiring flora that cover your skin from outside. So this is the source of skin flora. Also being exposed to air and to the surrounding objects and being handled by the medical staff and by your parents also provides you with stable flora on your skin. Why are we saying stable? Because there are some organisms that stay for a while and then they leave your body if they find that the environment is not suitable. But friendly flora should be stable. And when we say stable, normal flora, we mean friendly flora. They are normal because they will be from now on normal inhabitants of your body, and they are stable because they will live there forever unless there is a process that prevents them from doing so. And then the last process that gives you friendly flora is suckling, and this will give you stable, normal flora in both the oral cavity and the intestines. There are microorganisms that are famous for being in the oral cavity, and on top of them, we have the lactobacillus, which might one day turn pathogenic, and in the small intestine, we have the famous bifidobacteria that have plenty of benefits for your body. And now we move on to symbiosis. Symbiosis is a biological relationship. So when you talk about symbiosis, you are talking about a relationship, but there are characteristics of that relationship. What are the characteristics of that relationship? First of all, it is a close relationship, meaning that the organisms are present in close proximity. Number two, it is a long-term relationship, meaning that in order to describe the relationship as symbiotic, it has to last for a long period of time. And number three, it should occur between three different species. So these three items must be mentioned in the definition. In the next paragraph, we show you that the impact of that relationship on the two members of the relationship is not always the same. So for some of them, it's beneficial. For some, meaning that you gain benefits. For some of them, it is neutral, meaning that you gain no benefits, nor are you are not harmed. Or for some of them, it is harmful. But this describes only one side. So this paragraph is not important in the description of symbiosis, it's just an introduction. But what is important are the definitions that we are going to mention. Commensalism is actually nowadays seen as rarely applied relationship, because what does commensalism mean? It means that the commensal will get benefit in the form of what? In the form of food and shelter. But meanwhile, on the other hand, it neither benefits from the relationship nor is harm. So it is a win relationship and then zero, win-zero relationship. For which organism, for which partner? For the commensal. So the commensal wins, takes food and shelter, but in return it gives neither harm nor benefit. Okay, so in the past we used to describe the relationship between friendly flora and human beings as a commensal relationship, or as commensalism. And here letters A and B are an answer to why commensalism is not the perfect description for the relationship between friendly flora and human beings, or when I say man, I mean human beings. So this relationship cannot be described as commensalism, because why did they used to describe it as commensalism in the past? Because they used to think that only friendly flora win from the relationship, whereas man has zero impact, or suffers from zero impact. Zero impact. But I'll pause for a while. So, as I said before, it was supposed to be commensalism because they thought that man gains no benefits and is not harmed. But nowadays, it's being thought that commensalism is not the correct description, but it is mutualism, because there is exchange of benefits between the two partners. We know the benefit that is taken from man, which is food and shelter, and the benefit that is taken from the friendly flora is, I'll start by B because it's the easier one, it's occupying space. When they occupy space, then they divide and fill in the space. So they compete with pathogens for what? For habitat and, of course, for food by occupying space. And therefore, when the friendly flora increase in number, they prevent colonization by pathogenic bacteria. And this is the benefit that is easy to remember by all of us. The second one is what we called at the end of the year when we were about to finish the presentation. It is weakly stimulating the immune system. And we call this local immunity because it occurs in the local habitat, meaning that if the organism lives in the oral cavity, then it stimulates the white blood cells in the oral cavity. And if the organism is in the gut, like bifidobacteria, then it will stimulate the immune system or the white blood cells in the gut. And that's why we describe this as weak stimulation of the local immune system. And when the local immune system or the white blood cells are stimulated, they will attack the pathogen. But at the same time, as we said before, there is an agreement between the friendly flora and the white blood cells or the immune system not to attack the friendly flora. They've been taught this during your stay in the uterus. Why do we say weak stimulation of the immune system? Because the friendly flora are essentially visualized by the immune system as if they were our cells, as if they were self, but they have a few antigens that differ from us, and those antigens are capable of weak stimulation of the immune system. And as we said before, the pathogens themselves should have common antigens with the friendly flora. Again, what is an antigen? An antigen is a substance that is capable of awakening or stimulating the white blood cells. All this paragraph A, we use to call all the content of, or to describe the content of this paragraph. And we said this in the previous video as being cross-reactivity, which is an indirect way of killing the pathogens. As we said before, the relationship should be described between friendly flora and man as mutualism. And if you were to describe mutualism or to define mutualism, you should start by exchange. Exchange of what? Of course, exchange of benefits between two partners of two different species. And that exchange of benefits lasts for a long period of time and they live in close proximity to each other. And one of the examples are the colonic flora that occupy space and that produce vitamins. In the third relationship, which is parasitism, one organism benefits and the other organism is harmed. So we have a gain or benefit lose relationship or a win-lose relationship. We have three famous classes of parasitism. You can also say, of course, pathogenicity, but the term pathogenic is broader than these three classes. So because conventionally and traditionally parasitism or the parasites have been classified into these three classes, while pathogens are broader, for example, viruses cause harm and are considered pathogens, but they do not belong to any of these three categories. And therefore, we say that the term pathogen is broader than the term parasite. The three main classes are the protozoa, the helminth, and the ectoparasites. The protozoa are pathogenic organisms that are unicellular, and they have one true nucleus, so they are eukaryotes because they have a true nucleus, and they are at the same time unicellular or one-celled. And the best example is the entamoeba that lives in fresh water and that causes, or that might cause, gastroenteritis, which means that you would have vomiting and diarrhea. On the other hand, we have the helminth, or the worm-like parasites, or the parasites that are worms. And the best example is bilharziasis that we studied before while we were studying hematuria. And the third class of parasites are the ectoparasites, and these are the parasites that live on the surface of the body, like the lice and the fleas. They cannot live inside the body cavities. They live on hairs, they live on the skin. And here, of course, you have pictures, but you don't have to draw them. In this slide, of course, we talked before about the characteristics of the pathogens. They can invade or penetrate the body cells, therefore affecting your normal biological functions and resulting in a disease. So as we said before, you might be asked to define a pathogen, and this is the definition. It should include the term invade. It should include the consequence, which is the occurrence of a harmful biological response or a disease. And we said that the pathogen is more inclusive than the parasite. One evidence is that viruses are not parasites, but they are pathogens. They do not belong to the three traditional classes. And now we have a famous justify question, which is justify why viruses are obligate intracellular parasites. Obligate because they cannot live outside. Intracellular means that they can always, or they can only multiply and increase in number and reproduce inside a living cell. If they stay outside a living cell, they cannot reproduce. So it's mandatory for them to be inside, or that is a necessary condition for them to be inside a living cell in order to be capable of reproduction. And now on this slide, we have the definition of a microbiome. The microbiome is the community of all the living organisms in a particular environment. This is the easier definition. So you have to mention all microorganisms and in a particular environment. So you cannot say microbiome absolutely. You can say the oral cavity microbiome, or the gut microbiome, or the skin microbiome, or the urinary tract microbiome, the total of all organisms in a particular environment. The more recent definition like describes all the microorganisms as all their genetic material, because this definition considers that the DNA of the living cells of the microorganisms is what really counts in determining the properties. So it's more accurate to say the combined genetic material, but again, of all organisms in, again, a particular environment. The microbiome is not there to do nothing. They play different roles. They can ferment food and digest food. They can stimulate local immunity. They are responsible for your overall health, your nerve health, the formation of your body cells, your mood, your correct behavior. They also affect metabolism. They also affect how your biochemical reactions go, at least by producing vitamins that are cofactors. So the microbiome is not a stagnant, standstill microbiome. It's a dynamic microbiome that interacts with your body. This interaction is mostly in the form of exchanging benefits, like in mutualism, but is sometimes harmful, like in pathogenicity. Do we all have the same microbiome? No, because there are factors that affect the microbiome. The first factor is your genes. Why your genes or your genetic makeup? Because your genes will affect your diet, your genes will affect your immune system and how it deals with your flora. Your genes will affect how much hormones or how many hormones you produce and in what quantity. So the genes affect everything in your body. So it's normal that genes come as the first factor in affecting your flora makeup, but also the way you were delivered. And here we have an important justify question. We always say that the newborn any newborn that is born through normal vaginal delivery has better immunity. This is because normal vaginal delivery allows a more diverse skin microbiome. Why? Because it's taken from the vaginal canal or the birth canal. Another justified question is, why are breastfed infants in the first years of their lives having better immunity? The same, because when they suckle milk, they get oral flora and gut flora from where? From the skin around the nipple and the skin of the breast. So they again have a more diverse microbiome. And then age is a fourth factor. As you grow older, of course, there is a decline in the flora as a whole, in the number of flora as a whole, but there is a decline in the friendly flora in particular. So we find that the friendly flora diminish and the pathogens increase in number, and therefore there is a disturbance in the ratio 85 to 15, and this is what we call a population shift. This is what we call a population shift, or what we call dysbiosis. How is this reflected on old people or during senility? Senility means old age. This is reflected as some degenerative diseases of the brain, like Alzheimer's disease. Degeneration means decline in function. So, a degenerative, when I say that Alzheimer is a degenerative disease, this is because in Alzheimer's disease, there is a progressive decline in the nerve function until we reach dementia. Why does this occur? Because normally, before reaching old age, we have a very protective pathway, which is the brain gut microbiome axis. If this is part of the gut and this is the brain, so via blood, there is a connection of blood vessels that connect the gut to the brain through the heart, of course, and through the blood, so the cardiovascular system, and any useful chemical product that is produced here in the gut will be carried via blood to the brain. So we have important neurotransmitters, and at the same time, they are hormones. So we call them neurohormones. like dopamine, which is, of course, the reward hormone or the reward neurotransmitter. And we have serotonin, which is the happiness hormone or the happiness neurotransmitter. And both of them circulate to reach the blood. They are neurotransmitters, and this means what? That they can, if this is the nerve cell number one and this is the nerve cell number two, they facilitate transmission of electric impulses from one neuron to another, and at the same time they circulate in blood. So they are not only neurotransmitters, but they are also neurohormones. In addition to this, we have fatty acids, the building blocks of the fat, but the ones that are useful for the brain are the short chain fatty acids. We write them SCFAs, short chain fatty acids. They also protect the coverings of the myelin sheath, which is an important fatty layer that covers these axons, the long processes that arise from the nerve cells. And all these substances, the fatty acids, in addition to the vitamins, in addition to serotonin and dopamine, they are called signaling molecules because they are produced from one cell and they go to another cell. They are produced by the gut cells and they signal the brain cells. They give them messages, and these messages are chemical messages. Diet is also an important factor, and of course, a variable diet would be better because it would include all what your cells need. Your cells need what? Your cells need proteins. Your cells need fatty acids, as we said before. Your cells need vitamins because they act as coenzymes. Your cells need water, of course, because the water represents a good deal of the cytosol and of the organelles. Your cells also need glucose and some carbohydrates to get energy. So a varied diet or a diversified diet would be a healthy diet. And it's good news that a healthy diet favors the friendly flora. So we can call them healthy flora because they feed on a healthy diet. So when you take a healthy diet, it's not only that you're benefiting yourselves, but it's also that you're helping the friendly flora to flourish and to increase in number. And here we have two examples, an example of a good diet and an example of an unhealthy diet. Fibers, dietary fibers within limits are considered prebiotic. What is a prebiotic? A prebiotic is food for friendly flora. Why are they food for friendly flora? Because when they are broken down in the gut, by the friendly flora, they produce short chain fatty acids. Short chain fatty acids and energy, and a small amount of energy. The energy is good for the friendly flora. The short chain fatty acids are good for you because they support the health of the gut mucosa. They minimize inflammation, and then they are absorbed to the brain where they prevent Alzheimer's. So again, the prebiotics are food for beneficial bacteria. The best example is the fibers. They are broken down by the friendly flora to produce short chain fatty acids and energy. The energy is for the friendly flora. The short chain fatty acids are for you. They help good functioning of your gut mucosa. They minimize inflammation, and they go to the brain via the gut-brain axis where they support your brain health. On the other hand, we have an example of unhealthy food. So this slide is important because it gives you an example of healthy food. It tells you what prebiotics are. but it is also useful because it gives you an example of an unhealthy food like saturated fats and animal proteins. As we said in the classroom last time, these two cause an imbalance in the microbiome. They cause what we call, again, dysbiosis or population shift, which is a disturbance in the ratio between friendly flora and pathogens in favor for the pathogens. They cause inflammation, and as we said before, the inflammation results in a disturbance in the ratio between the leptin hormone, which is the hormone of satiety, and ghrelin hormone, which is the hormone of hunger. But this biosis also results in resistance of the receptors to insulin and therefore results in diabetes. Furthermore, this biosis results in heart diseases because of deposition of fat inside the blood vessels of the heart, which might lead to cardiac attacks. But on the other hand, there are healthy fats. For example, olive oil is an example of healthy fat. Nuts are an example of healthy fats. So there are fats that are healthy. On the other hand, this is another example of harmful diets that are rich in white sugar or in white flour or in processed foods. And processed foods are usually preserved foods. And as we said before, they use, especially in preservation of meat, like bull beef, for example, and luncheon, they use nitrites. The nitrites are broken down by the gut flora into nitroses, and the nitroses are carcinogenic, meaning that they increase. It's not written on the slide, maybe, but we said it several times in class. But what about the refined sugars and the refined carbohydrates? By refined sugars and refined carbohydrates, I mean white sugar and white flour. So you have white sugar, this is refined sugar, and white flour. Both of them do what? They help the growth of bacteria and fungi. Candida is a unicellular fungus. And at the same time, it diminishes good, friendly flora. That's why we say that again, white sugar and white flour cause dysbiosis or population shift, which again will result in obesity, as we said before, diabetes mellitus, and in heart attacks. The last item here, which is a good item, or the last two items. So here we only have this paragraph talking about unhealthy food. And we have the healthy oils, and we have here an important item, which is the probiotics. But before discussing the probiotics, we can collect the healthy food or we can summarize the healthy food and the unhealthy food items. So amongst the examples of healthy food items, we have the fibers. Of course, first of all, we have a diversified diet. We have the healthy oils like the short chain fatty acids, the nuts, and olive oil. And unhealthy food, we covered the diets that are rich in saturated fats, the diets that are rich in red meat, the diets that are rich in white sugar and in white flour. So this is the list of unhealthy foods up till now. But the list of healthy food is longer So we have yogurt, for example, and we have all the colored or most of the colored food items. Concerning yogurt, yogurt is very important because it is a probiotic, and it is very important to remember the difference between prebiotic and probiotic. We saw the prebiotics on the last slide. They are food for good bacteria, and the best example was the fibers, and they enrich good bacteria indirectly. But probiotics are food items with friendly flora. They contain already friendly flora like yogurt, and therefore by taking probiotics, you are enriching the community of friendly flora inside your gut. So we would do like very short comparison between the probiotics and the prebiotics. So the prebiotics are food for friendly flora, food for friendly flora. They are metabolized or broken down by the friendly flora to give them energy and therefore to increase them in number. So it is an indirect way of increasing the gut flora, and the best example is the fibers. On the other hand, we have the probiotics. The probiotics are not food for friendly flora, but they are food that contains friendly flora, like yogurt, food that contains friendly flora, like yogurt. So they are not metabolized to give energy. They already contain friendly flora, and the best example is yogurt, and it is a direct addition of friendly flora to your body. The last healthy item here is the colored food. Most of the colored foods, like berries, whether they are blueberries or blackberries, dark chocolate, green tea, of course, we do not consume wine, olive oil, and coffee. They are mostly colored and they contain antioxidant. Antioxidants means what? They prevent oxidation, or they do not actually prevent, they minimize oxidation in the body. And how do they minimize oxidation in the body? By increasing reduction or addition of electrons. And we saw oxidation and reduction when we were talking about how to determine the presence of glucose in urine. Reduction is addition of hydrogen or addition of electrons. The best example, for example, is vitamin C. And that's why we always say that vitamin C is good for your immunity. And essentially, it is good because it is an antioxidant. Why do we want to minimize oxidation and to increase reduction? Because when you increase oxidation, the oxidized material, which is called free radicals, if you want to get a bonus, free radicals is harmful, because those free radicals that are the result of high oxidation in the body will oxidize everything in the body. They will oxidize the cell membrane, they will oxidize the organelles, the enzymes, and everything, and they would therefore harm the function of these organelles and cellular structures. Another important question is how stress affects the friendly flora. Of course, stress results in dysbiosis, which means a population shift, and this population shift is in favor of pathogens. And you can give examples of stress, weaning, which is the stopping of breastfeeding at the end of the first 2 years of life, teeth eruption, the appearance of milk teeth in infants and children, puberty, of course, with all the hormonal changes, menopause, which is also the cessation of menstruation in a female. The seventh factor is gender, and here there is a common question. Why are the friendly flora or the microbiome in general more diversified in case of females? The first factor that helps diversification of the friendly flora in females is the fluctuation in the hormones that occurs during the menstrual cycle, and as well as when there is cessation of menstruation after the menopause, as well as pregnancy. So we have three major events in the life of the female that cause fluctuations in hormones. The first one is the sudden surge of female hormones at puberty. On the other hand, we have the other extreme, which is the cessation of menstruation after menopause. And in between puberty and the menopause, we have the hormonal fluctuations due to the menstrual cycle. In addition to the hormonal fluctuations, which are the first reason why there is diversification in the gut flora of a female. We also have the lifestyle, because the females usually have more diversified diets that depend mainly on vegetables, which are good food for friendly bacteria. Why are vegetarian diets better? Because vegetarian diets have more fibers, and the fibers are considered prebiotics, and at the same time, the vegetarian diet allows you to have less red meat and all the food items that are carcinogenic. On the other hand, males have a protein-heavy diet, and we all know how red meat results in dysbiosis. The eighth factor is medication. So I might ask you about the effect of medications on the friendly flora. We have two examples of medications here. We have an example of a good medication, which is the probiotic. Actually, it's not a medication, it's a food supply. And this food supply is nothing but capsules, and these capsules are full of friendly flora inside. So when they go to your gut, they open and they release all the friendly flora. On the other hand, we have the antibiotics, and the antibiotics are important. There are several points that you have to retain about the antibiotics. First of all, that they kill both the friendly bacteria as well as the pathogenic ones. When they kill both friendly bacteria and pathogenic ones in your gut, so they will leave a free niche. And a free niche means an empty habitat where no organisms at all are present. And when there is a free niche, there is a possibility of inhabitation by non-indigenous species. Non-indigenous species are the species that are not normally present in this particular habitat, and you can never guarantee whether these non-indigenous species will be friendly flora or will be pathogens, and you can never guarantee that the ratio is 85 to 15 as normal. This is the first point we have to retain about antibiotics and how they affect the microbiome. But there is another important question about the antibiotics, which is the development of antibiotic resistance by bacteria. This is very important. One of the major drawbacks is the antibiotic resistance. What do we mean by this? When you take an antibiotic, you have to take the full course. And when we say the full course, we mean that you have to take an adequate dose. For example, if the medical doctor prescribes 1 gram per 12 hours, so you have to take 1 gram. So first of all, the dose or the quantity of the antibiotic. And then number two, the time intervals. If you are to prescribe 1 gram every 12 hours, then it has to be 1 gram every 12 hours. And finally, the total duration of the antibiotic. For example, if the doctor says that you have to take this for a whole week, then you have to take it for a whole week. Any shift from those three conditions, the dose, the time interval, and the total time duration, will result in an incomplete dose of antibiotic or an inappropriate dose of an antibiotic. What are the next important question is, what are the drawbacks of an incomplete course of antibiotic? When you give an incomplete course of antibiotic, you kill only the sensitive bacteria. And by sensitive bacteria, we mean the ones that are responsive to the antibiotic. But you leave those that are resistant. You leave the resistant bacteria or the resistant ones untouched. Not only do you leave the resistant bacteria untouched, but you leave them uncompeted. And those resistant bacteria arose from where? They are mutant bacteria. So again, when you take, suppose for example, that these are the normal bacteria and the letter M like describes the mutant resistant bacteria. At the beginning, the sensitive bacteria are the ones that are predominating. They have a larger number. And then when you kill those sensitive bacteria, there remains only the mutant bacteria. And the mutant bacteria will flourish and increase in number, so that by the end of the course, the mutant bacteria will represent the majority, and they reproduce very rapidly because they are uncompeted. Those resistant bacteria do not only why is this risky to take an incomplete dose of antibiotics? Because they represent a risk to you. You are irresponsive. If you take the antibiotic once again, you become irresponsive to the antibiotic, but at the same time, you are infecting other people with microbes that are not responsive to the ordinary antibiotics. In the previous revision, we talked about the content of this slide, the factors that help flora change their behavior. Immunocompromisation, you have to know them very well, the hormonal changes, and the damage to the skin membrane. Maybe we didn't mention the damage to the skin membrane. When you have an injury in the skin, like a wound in the skin, why does this favor the flora or encourage the flora to change their behavior? Because you are just helping them to penetrate through this wound. So you're facilitating their task, you're facilitating the fact that friendly flora would be converted into a pathogen. For example, Staph aureus, which is normally on the skin, can penetrate this wound and become pathogenic and cause penetration and inflammation, and at the end of the day, pus and a purulent discharge. So flora can become pathogenic. So some pathogens were originally friendly flora. We covered the morphology of the bacteria and we covered the content of this slide, but we didn't cover this part, which is usually a justified question. Why are bacteria and fungi more flourishing in those areas? Because they have more moisture, like sweat, for example, or humidity between the toes, or because of warmth. So moisture and warmth are the main effect, the main factors that result in flourishing of bacteria and fungi in these areas. Or I might ask you to list or to give examples of areas that are famous for having a lot of bacteria and fungi. So you would say the axilla, the groin, and the areas between the toes. All these areas have warmth, have moisture, retained moisture, because they are folded, hidden areas. They are not exposed areas. We covered the rest of the slide. We covered acne vulgaris, which is important to know the signs and symptoms of acne vulgaris, like swelling, like redness, like pain, and of course, the pathogenesis. When I say the pathogenesis of acne vulgaris, I mean how acne vulgaris develops. You have to start by puberty, and then by the increased androgens, and then by the changes that occur to sebum, and then by the entrapment and the anaerobic environment, and then by P. acnes being converted into a pathogen. And then I told you in the past video that you have to know the definition of acne vulgaris. I want to see chronic disease, skin disease, blockage, inflammation. These 5 words are golden words in the definition, and you have also to add the site where all this occurs, where the blockage and inflammation occurs. It's not only in the hair follicles, it's not only in the sebaceous glands, but in both. Why? Because as you see in this diagram, the sebaceous glands are exocrine glands, and they open into the hair follicles. What are the factors that predispose you or help you to have or to increase the likelihood of acne vulgaris? We have the genetic factors. There are some people who are genetically more predisposed to others, and there are hormonal factors. Of course, we talked about the hormonal factors. We said that it is more common in males because it's mainly the androgenic hormones. And we said that it can occur in the females at puberty just because they also have an increase in the small amount of androgenic hormones they have. We talked about plugging of the hair follicles. But there is an important point we didn't mention, which is the causes of plugging. We only mentioned one cause, but actually there are 2 causes for plugging. The changes that occur in the sebum, being thicker, being more abundant, being stickier, as well as the epidermal proliferation, because the epidermal proliferation, or increased number of cells and cell division in the duct, when the cells divide rapidly, they block the duct. So both the changes that occur in sebum as well as epidermal proliferation are the causes of blockage of the duct. The genetic factors increase the likelihood in some people of having acne vulgaris, because there is an underlying reason, because your genes determine the nature of your skin, whether your skin is dry or oily. Of course, oily skin would be more affected. Your food preferences, for example, your genes will determine whether you would love nuts or not, you would love chocolate and dairy products or not. Nuts, chocolate, and dairy products are food items that increase the likelihood of acne vulgaris. We also haven't mentioned the nasal cavity microbiome, and here we have to talk about the nasal carriers. What is an asymptomatic nasal carrier? This is an important question. The asymptomatic nasal carrier. When I say asymptomatic, this means that it's subclinical. There are no symptoms that are apparent on the patient. And when I say that the patient is a carrier, I mean that although the patient is asymptomatic and does not show symptoms, yet he is or she is a carrier of the microbe, meaning that in their nasal cavity, we have the microbe, which is usually Staphylococcus aureus. And this microbe, which is Staph aureus, is a normal resident of the nasal cavity in those people, but it is asymptomatic. Why? First, are this bacteria asymptomatic? First of all, because they are non-virulent, meaning that they are not, they do not possess strategies to like overcome the immune system. Number two, because we have strong immunity, meaning that the immune system is high, is efficient. And number three, the dose, because usually when the number of bacteria is not that big, and we mentioned this before, then the likelihood of infection is very low. But the problem is that those bacteria are potentially pathogenic, meaning that they are essentially friendly flora, but they might turn pathogenic. When can they become pathogenic? The opposite of the three causes which we mentioned before. If the immune system gets lowered for any reason, or if the dose of the organism increases for any reason, then they would penetrate and become pathogenic. The second question, other than to define an asymptomatic nasal carrier, is to mention the risk of those nasal carriers on themselves and on the community. On themselves, they infect their own skin when they cough or sneeze, and their saliva or nasal discharge descends or settles on an infected skin, then they might infect themselves. And this is what we call auto-inoculation. Auto means self, you are infecting yourself. And inoculation means you are injecting the microbe into a minor wound and therefore infecting yourself, or you can spread this to the rest of the community. And why are they risky concern? Why are nasal? Another important question is, why are nasal carriers important, or why are nasal carriers in particular risky to the community? Because people do not know that they have those bacteria inside, and therefore, since they do not know, they do not take the necessary precautions, like, for example, leaving a distance, a safe distance between you and the patient. Of course, the routes by which the infection is spread is very important. So we have droplet infection and direct contact. Droplet infection occurs via air or via dust or via food. And droplet infection simply means that the patient coughs or sneezes. So you have to start by this. The patient coughs or sneezes, and then it releases droplets in air, and those droplets of nasal discharge or droplets of saliva will be spread. If they are spread via air and then inhaled by another person, then it is airborne infection. If those droplets fall onto dust and then dust dries out and is released into air, then this is dust-borne infection. If the droplets fall onto food, then this is food-borne infection. And then we have the direct contact. Direct contact means what? Direct contact means that you have hands that are contaminated by your own nasal discharge or your own saliva, and then you directly shake hands with another person. So the microbes are transmitted from one person to another. Or you have this infected hand and you touch an apple, for example, and then a person comes and eats this apple that has the transferred microbes here. So first of all, shaking hands is one way. Holding an object like holding a food, for example, like an apple, but with food you also have biting. If this is your bite, then your saliva has been transferred. And the third one is object. For example, if you hold whatever, a book, for example, and that book you have transferred the bacteria onto that book, then whoever holds that book will be infected. We talked about the conjunctival microbiome and how the conjunctiva is protected mechanically and chemically. And then we said that those organisms that can infect the conjunctiva have special strategies to infect the conjunctiva, like attaching themselves. There are two strategies, which are number one, to attach themselves strongly to the conjunctiva, and number two, to withstand lysozyme and zyme. On this slide, there are two important items. First of all, Neisseria gonorrhea is a like sexually transmitted disease, and it occurs during vaginal delivery while the person, the newborn, is being delivered via the vagina. And the microbe is Neisseria gonorrhea, and as you can see, it is a Diplococcus, and it infects the eyes, and it's severe infection. And the problem here is that you have on the spot to instill antibiotics in the eyes, and we usually do this as a prophylactic or protective way of protecting the conjunctiva or preventing infection. So the second question is, why do we instill antibiotic eye drops? In order to prevent acquiring any disease from the mom's vagina. The third and last item, or actually the second item, is what happens to people who have decreased lacrimal secretion. If you have decreased lacrimal secretion, then you have diminished protection of your eyes. So you have diminished, because the eyes provide, the tears provide both mechanical protection and chemical protection. So if you have dry eyes, if you don't have enough tears, then you will have diminished mechanical protection and diminished chemical protection. Diminished mechanical protection because there is no liquifilm, and by the way, it is liquifilm, not biofilm, as well as wiping away by blinking. So the mechanical protection is both the liquifilm and blinking, but you also lose or miss the chemical protection, because if you don't have tears, then you don't have lysozyme enzyme. And what does lysozyme enzyme do? It destroys the bacterial wall and therefore prevents bacterial multiplication. We mentioned the protection of the urinary tract on the last video, and we talked about the vaginal microbiome and how acidity of the microbiome in the vagina or acidity actually of the vagina is important, because it kills candida or unicellular fungi. If the acidity is more than needed, it results in killing of the sperms, and the acidity arises from lactic acid, and lactic acid arises from glycogen being broken down in the vagina, and glycogen increases when puberty starts because of estrogen. So it all starts by the estrogenic surge. I said it rapidly because we mentioned it several times before. I will stop here, and then there will be another short video that will be, and the last one, which is part 3, that will be uploaded on Google Classroom very soon.